Ladies and gentlemen, good morning once again to EULAR TV. Yet another exciting day, and it's day 4, and I know we are all waiting for the EULAR recommendations, which is coming finally, and we are excited and be honored to be joined by Professor Laure Gossec, and she will be talking about the updates of psoriatic arthritis today, and I'm with my co-worker, Anthony Paras.
Hello, Professor Gossec, nice to have you here. Thank you very much for accepting our invitation. So, would you like to tell us what is new on psoriatic arthritis?
Well, there have been many changes over these past few years for psoriatic arthritis. Firstly, since we last updated the recommendations in 2019, we have 3 new drugs which have been put onto the market. 2 of them have a new mode of action, and we also have another drug which will be licensed very soon, and this also has a new mode of action. So we're very rich now in terms of treatments for psoriatic arthritis. On top of conventional synthetic DMARDs, we now have 6 modes of biologic DMARDs, as well as 2 modes of targeted synthetic DMARDs. So that's a lot of drugs to look at and to think about when we treat our patients.
As it anticipated that this new medications is coming up, and would you like to mention anything about the early phase of the treatment of psoriatic arthritis?
Yes, thank you. At the early phases of treatment, we want to stay with the drugs that we know very well, so non-steroidal anti-inflammatory drugs and conventional synthetic DMARDs. But we have changed in the recommendations the way we approach these early treatments in terms of who should go straight to a disease-modifying drug and who could be on NSAIDs. And basically, we now propose that only patients who have oligoarticular disease with no poor prognostic factors, or patients with enthesial or axial disease should get NSAIDs, and even in that case, it should only be for maximum around 4 weeks before they go on to a combination of NSAIDs and some type of disease-modifying drug.
Thank you so much.
So, Professor Gossec, apart from the early phases of disease management in psoriatic arthritis, what are the other challenges, especially in refractory disease, with the new biologics? And what is the main message you would like to communicate with the rheumatology community today?
That's several questions in one. But yes, there has been, I think, a shift, almost a paradigm shift in the new recommendations, which everyone will discover in a few minutes now. But the main change is that on top of focusing on the musculoskeletal manifestations, which we, as EULAR, Rheumatology and Health Professional in Rheumatology Association, we have always done that. We now have really added a new, very strong recommendation about the importance of looking at extra musculoskeletal manifestations. And we divide these into 3. Psoriasis, of course, which is very frequent in psoriatic arthritis, and there are some drugs which should be preferred in such cases. And then also inflammatory bowel disease. There have also been some new drugs licensed for inflammatory bowel disease over the past few years. So that's important for rheumatologists to know about, and also uveitis. So I think that's quite a big change in the way we now address the treatments. And then you asked me, what's my message for our colleagues? I think the message is really, we have to strive for the best balance between efficacy and safety. We've had some new safety signals over the past years. Everyone is aware of the oral surveillance trial of tofacitinib in rheumatoid arthritis, which led both the FDA and the EMA to issue a comprehensive warning for the use of these drugs, which of course we've integrated into the new EULAR recommendations. And really my message is, we have many drugs now available, and really be careful when you choose the drugs so that you can optimize the management of our patients with psoriatic arthritis.
Thank you. Let me ask you one more question. I wanted to ask you, and take this opportunity, what this new recommendation mean for our patient? Will they have a better control of their disease and better access to the medication?
Access to medication is a really difficult issue in some countries within EULAR, as well as some countries outside of EULAR. Because, by the way, we consider that our EULAR recommendations are applicable worldwide, I have to say. To answer you, I think that these new recommendations integrated in the new drugs that we have and the new efficacy and safety data that we have should allow better access to the best treatment. But you know, we still need to work on that, and that's also why EULAR has to perform advocacy on behalf of patients with RMDs to ensure everyone has access to optimal quality of care.
Professor Gossec, thank you very much for sharing your expertise with us and the rheumatology community today. We're looking forward to listening to your detailed presentation later in the main auditorium.
Thank you very much.
Thank you very much.
Thank you.